Congratulations! The birth of your baby is something to celebrate, and a good celebration usually includes plenty of food. As you welcome your newest family member, you'll probably be concerned about making sure they get enough to eat. If you've decided to breastfeed your baby, you may be anxious to get started. You may also feel overwhelmed or confused about how to get started. In this video, we want to give you an idea of what to expect as you and your baby work together to develop your breastfeeding skills. Now, let's talk about some normal newborn behaviors you can expect from your baby today. While you've been anticipating their arrival for months, this celebration comes as a bit of a surprise for your baby. Most newborns respond to the excitement of their birth with an alert curiosity for the first couple of hours of life. During this time, your baby may have their first feeding at the breast. After that, your baby will become sleepy. Spending time skin to skin is an excellent way to help your baby feel warm and comfortable. As they become hungry again, they'll start searching for the breast. This can take several hours. You may observe your baby swallowing, gagging, spitting up, or sneezing. That's because your baby lived in the amniotic sac, a fluid-filled sac inside your body. Your baby may not be interested in eating until their nose is clear and their tummy is empty. This can take several hours. If your baby is gagging, spitting up, or gassy, they may be too uncomfortable to eat. They may push away or resist the breast. They may cry during breastfeeding attempts. It can be helpful to hold them upright on your chest and pat or rub their back to comfort them. If your baby is crying at the breast but comfortable on your chest, they just may not be ready to eat yet. Sometimes your baby will latch to the breast, but then quickly fall asleep. This might cause you to worry that your baby isn't breastfeeding because you aren't making enough milk. Today, you're making a very small amount of milk because your baby has a very small tummy, about the size of a marble. Over the next few days, your baby's tummy will grow, and so will your milk supply. While you wait for your baby to become more interested in eating, it's common to feel concerned. But for some babies, it can take 24 hours or longer before they are ready to eat. Here are some things you can do to practice and encourage breastfeeding. We expect your baby to be sleepy, and we expect your milk supply to be very minimal. This is normal for your first day together. For today, we encourage you to snuggle, to rest, and to try breastfeeding. A great time to try breastfeeding is any time your baby shows hunger cues. A hungry baby will usually bring their hands to their mouth as they turn their head to actively search for food. If your baby is sleeping, we suggest waking your baby about every 3 hours to try. If your baby tries to latch, you can expect to feel them grab and stretch the nipple. During the feeding, you should feel a powerful pull on the breast, but it should not be described as biting, pinching, or painful. You can expect some nipple tenderness, but nipple damage is not normal. With a good latch, you shouldn't experience any nipple damage. It will be difficult for a sleepy or disinterested baby to get a good latch. Be careful not to force the nipple into their mouth. Instead, wait until they are alert with a wide open mouth. If your baby is not interested in eating, you can still practice holding them and moving them into a good breastfeeding position. Now, let's talk about pacifiers and supplemental feedings. You might be tempted to give your baby formula while you wait for them to start breastfeeding. But supplementing with unnecessary formula can interfere with breastfeeding success. Many newborns sleep a lot during the day and then wake up to cluster their feedings close together through the night. This could make some parents feel like their baby is using them as a pacifier, or using them just for comfort. It might also cause parents to worry about their milk supply. However, cluster feeding is considered normal newborn behavior. Just make sure your baby appears content between those feedings. If your baby is content, there is no need to offer additional food. But if your baby still appears hungry immediately after feeding at the breast, they may need more practice to improve their breastfeeding skills. If your baby was born at less than 37 weeks or weighs less than 6 pounds, they'll need more time to grow and develop their breastfeeding skills. For these early or smaller babies, we recommend offering 5 to 10 milliliters of additional food after each breastfeeding session, or at least every 3 hours. Your milk is the best food for your baby. The milk you're producing today is called colostrum, and it is thick, sticky, and usually gold in color. Before offering formula, we recommend hand expressing or pumping to offer your baby as much of your colostrum as you can. There won't be a lot of colostrum, but that's because your baby doesn't have a lot of room for food yet. If your baby is showing hunger cues or the need to continue sucking, be sure to respond by feeding or burping your baby until they are content. Avoid pacifiers until your baby is breastfeeding well. Here's a summary of what we talked about today. Breastfeeding is natural, but it is also a skill that requires learning and practice. You and your baby will be working together as a team to develop a breastfeeding partnership. Your role is to learn how to position your baby at the breast, while your baby will be learning how to latch and feed effectively. It can take 24 hours or more for your baby to develop the desire and the skills to breastfeed well. In many cases, it can take 1 to 2 weeks before you feel confident as a team. While you and your baby take some time to get to know each other, your nursing team is here to assist you. They can teach you about positioning, how to identify hunger cues, and how to determine a good latch. The lactation team is available for extra support after you've had some time to rest and recover. So relax and enjoy this special time with your baby.